Allie. Thank you so much for the gracious introduction. As Professor McConville said, I work with Grant Witness, and we are an organization that tracks terminations for federal grants, specifically for scientific organizations. And actually, the QR code you can see here leads you to our website, where we include our data sets, our reports, our visualizations about how these terminations have been affecting communities across the country, and it'll be included as we continue with these slides. But before I begin kind of discussing the insights that we can glean from the resources that we've created as an organization, I did want to talk a little bit about the policies, as we've seen the last presentation, that have impacted the terminations and the landscape that we're seeing here in the United States. So I will be focusing specifically on the NIH policies and how that has been impacting the terminations that we're seeing. But to be clear, there are different policies that have been affecting different agencies. So at the end of the presentation, I also include a list of references if you're interested in learning more about these policies. So to begin, on January 20th, President Trump, in his first day of office, had actually signed an executive order to end federal programs that promote diversity, equity, and inclusion. And then in order to align with these federal spending priorities, the United States Office of Management and Budget actually announced a federal funding freeze, and this was to halt the disbursement of federal grants and loans. Similarly, the next day, what we saw was that the agencies of the Department of Health and Human Services had been ordered to refrain from external communications with the public. This meant that the NIH, which is one of the agencies in the Department of Health and Human Services, was unable to issue documents, guidance, or notices until these documents and information could be approved by a presidential appointee. These informations and policies together basically led to study sections of the NIH to be terminated abruptly and unexpectedly. And these study sections are actually the meetings that are done at the NIH in order to review grants and ensure that grants are dispersed for projects. So with almost 2 weeks of uncertainty, on February 4th, finally, some of these study sections were allowed to return, but it was only because they had been scheduled prior to any of these communication freezes. And we also saw that the Federal Register itself was frozen, such that new study sections could not be scheduled during that time. Additionally, the administration actually required that grant review meetings be posted 35 days in advance rather than the standard 15 days. So within the first 2 weeks of presidency, we already saw that there was a huge delay in just evaluation of new grants and project proposals, which had led to a delay in $1.5 billion of funding, which would have usually been dispersed by March. But this is all having to do with new projects. What we also started seeing is on February 28th, the first mass terminations of NIH grants for existing projects. This means that these projects had already received funding in previous study sections from previous years, and these were ongoing projects, but we are seeing that their funding had been abruptly terminated. And so if you had seen the news and have been looking at the state of scientific funding, this is probably a lot of what you're hearing about at the NIH, NSF, EPA, DOE, is these mass terminations that are happening and affecting projects across the nation. Additionally, besides what we're seeing at an agency level, we've also noticed at universities that a lot of the funding cuts and freezes have been occurring, such that institutions that do not align with the federal agency's priorities are no longer allowed to keep their funding for research projects. So what does this mean for the current state of federal funding? It's very complicated and very messy, and luckily, we are seeing a lot of litigation and legal action being taken to help reinstate these terminations. But because these decisions are happening continuously, it's difficult to kind of monitor and track what grants have been terminated and who is actually being impacted. And so that is the role of Grant Witness, is basically to help create this comprehensive, rigorously cleaned and wrangled data set in order to understand who is being impacted and how much money are we losing from these terminated grants. From these data sets, we also create weekly reports and real-time visualizations in order for community members to understand at a nationwide and agency level the trends that we're seeing within these impacted grants. Additionally, our group does a lot of advocacy work with journalists, lawyers, congressional staff to help and reinstate these grants and ensure that whatever terminations we were seeing do not happen again in the future. So if you go onto our website, you'll actually learn more about the methods that we use to clean and analyze our data. But I did want to just provide an overview of how we go about collecting our data. And I would like to say that we group it into two different groups. One is the public reports. So there's a lot of news reports, social media feeds, and even reporting done by the NIH and NSF on which grants that they have terminated. However, a lot of this information tends to be at a more global level, so just the total amount of grants cut, and it's slow in order to understand what is happening on the ground in real time. So we also do a lot of crowdsourcing and community engagement by talking with affected PIs and scientists through our website's Google form in order to understand who is being impacted right now. And so from this data, we're able to collect a list of different grants at the NIH and NSF that have been impacted. So I'm going to be talking through some of the summaries that we can see based off of these data. So at the NIH, right now, there are 5,462 total number of impacted grants. And to be clear, when we define total number, we mean that these grants had been at one point terminated and or frozen. So even if right now they're identified as being reinstated, they were in the past terminated. And so of those 5,400 impacted grants, only 2,800 have been reinstated. So that's a little bit more than half. So we're definitely seeing progress towards reinstatement due to the legal actions that have been occurring recently. But of the 2,600 that still is not reinstated, we're seeing a current loss in funding of $2.31 billion. And that's just from the NIH alone. And I do want to emphasize, since we get a lot of questions about how we calculate current loss, that's calculated from the sum of remaining unspent funds. So in our data set, we actually include information about the total budget that's assigned for these different projects, as well as the total amount outlaid. And that total amount outlaid refers to how much of the money was actually used. So for example, if a project was assigned $500,000 as its budget, but only used $200,000 of it in the outlaid, the remaining unspent funds is $300,000. And so that is the total that we're seeing in our total loss of impacted grants. A similar summary analysis can be done for the NSF. So our data set includes 1,978 total impacted grants, and of those, only 617 have been reinstated. So that means only 31% of NSF grants have been reinstated. And of those 1,300 that have continued to be terminated, we're seeing a $704 million impact and loss in funding. And now I also want to kind of emphasize what we're seeing at a national level and the trends we're seeing across the country. So this is actually one of the first projects and the main contribution I had to the team when I first joined. And it's also the kind of coding that I learned in Kelly's class the first time I took it back as an undergraduate. So it's really nice to see the way that your stats knowledge and education can be used for these real world impacts. But what we see here is an NIH and NSF map. So the states and the shading coloring is based off of a percentile rank. So how each of those states in relation to each other are being impacted. So the states in yellow are the ones that are most significantly impacted. But that is to say, even the states in like this dark blue, purple, it's not that there are no grants that have been terminated. It's just that relative to the other states, it's just less. And so we see these kinds of trends at large research centers and hospitals that tend to make up states like California, Texas, Massachusetts, New York, Pennsylvania, and Ohio tend to be really impacted by these federal cuts. But we also see other regions that might not be well represented in the media or might not come first to mind when we think of funding cuts have also been impacted, like in the Southeast. And so if you want to, if you can go onto our website and actually interact with this graph, and you could see at a state level, what are the current number of impacted grants and how many are reinstated. We also have a static version of the map that you can download. And like I said, this information is constantly updated every week. So as of October 21st, in Pennsylvania, where we're giving this presentation, the total number of impacted grants at the NIH is 111, and only 31 of those have been reinstated. So of the 80 that continue to be impacted, we see a loss in NIH funding of $36 million. Similarly, for NSF grants, we have 55 grants that have been terminated and yet to be reinstated. So all 55 grants are leading to a loss of NSF funding of $19 million. And you can also go into our database and actually see which institutions have lost that funding for Pennsylvania or for any of the states provided on this map. So in the future, as we continue our work, we're hoping to expand the different agencies that we are looking at, such as the DOE, NASA, and EPA. And actually, we have a beta version of the EPA dataset available on our website if you'd like to look at it. It's beta because we're still trying to add in more information. So if you or anyone you know have been impacted by grant terminations at the EPA, we'd love to collaborate and learn more. Like I said, there's a Google form on our website where you can share that information. Additionally, we're planning to expand the kinds of reporting and visualizations that we've done. So I provided visualizations at an agency and nationwide level, but we're also looking at within agencies like the NIH, how different centers and institutes compare in terms of grant cuts. And as always, we're continuing to do community advocacy work, working on litigation to help reinstate a lot of these grants. So if you're ever interested in collaborating or just learning more about how you can use our datasets, feel free to reach out to us at info@grantwitness.us. And like I said, here are references, and also my email is up there if you're interested in getting in contact. Thank you.
So thank you for the things that you covered, Dr. Osmond, because now I can talk about some other things instead. So first of all, I should do this on here. I'm not speaking on behalf of the American Statistical Association. I'm speaking from my point of view as the executive director, but I'm not speaking on behalf of the association. And that frees me up to be very blunt with you about things. So my interest is in the federal statistical system, which is a vast system of data collection and dissemination. It is almost unimaginably large because we live in a large country with the largest economy in the world. I drove 3.5 hours to get here today. I just came from the Netherlands, where you can't drive 3.5 hours before leaving the country. We measure many things, and we need the federal statistical system to do that. And we have the envy of the world with our federal statistical system, with our government data. So unlike, the old saying about we don't know what we don't know, well, we are going to know, we already know what we won't know through what's happening with the federal statistical system. So let me just ask you if you have ever heard of the condition Munchausen by proxy or Munchausen syndrome by proxy. Okay, so this is a mental illness in which a person, a caregiver, often a parent, deliberately makes the person that they're taking care of ill because it brings them some sort of weird satisfaction. They get attention, they get something that they want from that. If you've seen the movie The Sixth Sense, that's what that comes down to at the end of that movie. This is what is happening. This is a good analogy for what's happening with the federal statistical system. Professor Osmond showed what was happening to some specific things. We don't even need to manipulate the data. We don't even need to get to the point where the data is being manipulated to have essentially the same impact as though it were, if the administration can convince people that the data is poor. So what's happening is the federal statistical system is being made ill. It's a large and complex system, as I mentioned. It's a very decentralized system, but it was working fine. Not perfect, as mentioned. It's been a bit malnourished for many years. Funding levels at best flat in many agencies, which essentially means that they're losing spending power. Data collection hasn't gotten simpler because people don't want to fill out surveys anymore, which a lot of federal data is based on surveys. So what the government has done is poisoned the system. And how has it done that? Well, it's done that, first of all, by firing lots of people without giving much thought to what they actually do and why they're needed. You've all read about the firings. Maybe the most recent ones are a great example where they fired people from the CDC and then realized, oh, wait, those people are doing things we want them to do. Well, they fired lots of people and without thinking about what that would do to data collection, or in many cases, probably they were thinking about what it does to data collection. It takes a lot of people to measure the US economy, to measure the health of US citizens, the various things that the US measures. One slide that I was going to show you, you all watched with horror a year and a half ago when the bridge collapsed in the port of Baltimore. But what you didn't know is, I didn't know, is that the Bureau of Transportation Statistics has data so that all the rescue workers, first responders, et cetera, could know precisely what ships were in the harbor at that time and when they were supposed to be leaving, and what ships were headed for the harbor and when they were supposed to arrive. That was key information in dealing with the chaotic aftermath of that disaster. That's just one example. I'll pick on one other area, the National Center for Education Statistics, may be the federal agency that has most been wiped out by the Trump administration. At one point, it was down to 3 people. Take that in for a minute. 3 people to try to keep a handle on our vast and extremely unique and decentralized education system. So starvation by, or poisoning by cutting people. Another kind of poisoning that's going on is the poisoning of hearts and minds. I'm going to skip down to here. See, there were a lot of wonderful slides here. You just wouldn't have been able to hear them. So I'm going to ask you to live with this statement in a minute, but I want to put it in context. Professor already mentioned that the SNAP program, Supplemental Assistance, Nutrition Assistance Program, is under attack from the administration, and they don't like the data that shows how many hungry people there are. And the USDA and the Economic Research Service, which is under the USDA, has reports that address those issues, and those reports were canceled. And so just to close my brief remarks, I want you to just sit for a minute. I won't read it out loud. I just want you to sit for a minute with this quote, and then I'm going to ask you a question about it. So what is the USDA saying here in effect? What does it look like to you? Maybe I'm just reading it wrong. Things are great. Things are great. And so the report must be wrong because things are great. And how do we know things are great? Because we said things were great. It's very hard to read that any other way than we know that if people in the countryside are experiencing lower poverty rates, increasing wages, and job growth. So this is the bottom line. If you can convince people that the data that they're receiving is wrong, then there's nothing that puts guardrails around the government saying whatever it wants to say about what's going on. And this is the discouraging and terrifying situation that we're in. I'll just stop for now with just this one last thing, that up to this minute, we haven't seen anyway any evidence of actual data manipulation. Okay. Yep. The BLS commissioner was fired. And, interestingly enough, the job numbers didn't go back up after she was fired. Somehow or another, they just didn't. And we're talking to a lot of our members who are in the government or were, and of course their morale is low and things are difficult. But up to now, no evidence of actual data manipulation. But there doesn't have to be. As long as people think that the data is wrong or being manipulated or deliberately political, then in effect, that accomplishes the same thing as the data manipulation. I think ready for questions.